The VA there's a memorandum of understanding between the VA and Department of Defense, where the VA can provide rehabilitation for spinal cord injury, traumatic brain injury, and blindness. So that memorandum of understanding has been in place, I believe, since the late 80s. And so the VA has traditionally done the rehabilitation for Department of Defense. So in the VA, we have an electronic medical health record. And so every service member that has separated from Department of Defense after September 11th of 2001 has an electronic trigger or a clinical reminder that is due, and that's expected that will be completed during their first clinical visit to the VA. So that typically happens in either primary care, mental health, dental, the women's clinic. But that's typically where the screen is completed. It's a 4-question screen, and if the individual answers yes to all 4 questions, it doesn't mean that they've had a traumatic brain injury, but they may have, and they need a more comprehensive evaluation. That then triggers a consultation to a TBI specialist within the VA, and that's typically within a polytrauma team, and they come in for a very comprehensive evaluation, which includes a thorough history trying to document the historical facts of what happened during the trauma and did they indeed sustain a traumatic brain injury. Then once that happens, they're either diagnosed with traumatic brain injury or possibly some other diagnosis, and oftentimes multiple comorbid conditions. And then the rehabilitation team then takes those diagnoses, works with the individual to develop an individualized treatment plan to help them meet their needs. So it's very much an individualized approach, which is really key to treating any traumatic brain injury.